Welcome. I'm Deirdre Vervo. Welcome to Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. I hope everybody is doing well. You may know me as the author of Home to Home, the step-by-step guide for senior living and housing, or being the owner of Just Like Home, the memory care home in Shelton with our 6 fabulous seniors living there. Tonight we have a special guest on. She is probably the most accomplished woman I have met, has more initials and letters and degrees to her name, to herself, than anybody I've also met. So quite an accomplished bio, which I am going to read to you. And tonight's topic is COVID, and there's a lot to know about it, even though it's been going on almost 2 years. There's so much to know. So Dr. Stephanie Paulmeno is the founder and CEO of Global Health Systems Consultants. It's a public consulting firm. She holds a doctorate in nursing and a bachelor's and master's degree in gerontology. She's a member of the International Nursing Honor Society, Sigma Theta Tau International. She is nationally board certified in public health through the National Board of Public Health Examiners, in case management through the Commission for Case Management Certification and through the National Council of Certified Dementia Practitioners. In case you want to know why you should be paying close attention to what she says. She was the Director of Community Health Planning for Greenwich, where she created the public health disaster response plans for avian flu, SARS, and the pandemic planning template for nursing homes. She created public health disaster plans and education curriculums for each of the biologic agents of terrorism, the Greenwich Mass Immunization Plan, and a computer interactive pandemic planning template for nursing homes. That's pretty cool. She's a member of the Red Cross Disaster Mental Health Team, and during the pandemic, she returned to the Greenwich Department of Health, serving as their public health promotion specialist. She's worked in clinical, administrative, and executive roles in the spectrum of long-term care in acute and chronic inpatient and outpatient psychiatric settings, and as the specialty areas of public, population, and community health. Dr. Paulmeno is past president of the Connecticut Nurses Association, chairman of the Patient Is You Foundation, trustee of the Connecticut Nurses Foundation, a founding board member of Wheel It Forward, Inc. We've had them on the show. Amazing place. A board member of the Southwestern Connecticut Area Agency on Aging. She's been twice elected to local public office, was an appointed commissioner on the Greenwich Commission of Aging and the Connecticut Commission of Health Equity. She's also a member of the Connecticut Public Health Association and the Greenwich and American Geriatric Societies. She speaks publicly on numerous health, aging, and public health topics. And she recently completed her PhD. She's quite accomplished. She's done many radio shows and discussions on this very topic about COVID, staying positive, staying safe, and what we need to know now. She brings new information to you. And if you want to know what's happening in the COVID arena, let's introduce Dr. Stephanie Paulmeno. Am I saying your name right? Paulmeno?
Paulmeno. You're one of the few who gets it right.
I want to make sure. So Dr. Stephanie, you are, oh my gosh, let me just show everybody a million degrees you have after your name. Like, you just love to learn and you bring a wealth of your knowledge to us, which I really appreciate.
Thank you.
So tell us a little bit about why you do all this and why you feel it's so important to spread the word about COVID.
Well, it's an interesting thing. I've been practicing as a nurse for 53 years now. And it's astonishing how quickly the years go. But nursing is a great profession because you can keep building upon it and be in many different areas and never leave nursing. Like, I started in pediatrics, I did psych, I did public health, I did gerontology, the whole range of the long-term care system. And it's all been exciting. But with COVID, when I did the plans for the town of Greenwich, everything was theoretical. because we weren't actually having a pandemic such as we're having now. We had the potential for it. We had some cases, but now everything is real. And we're living in a different world. I mean, all the public health measures that we put into the plan back then aren't really happening now. The public health directors had a great deal of authority to enact public health measures, but now governors and local elected officials now have that authority. So many of us in public health kind of sit there and think, well, what are we really doing to stop the spread of COVID when we're not doing the public health measures that we normally would consider doing? So,
well, is the government not implementing now that, or telling everybody what they should be doing? And wouldn't you be implementing that plan?
well, they do tell people what to do, but it's different. Like, for instance, when the personal protective equipment issue came up in the nursing homes and in the hospitals, I know as a director of nursing and as an administrator in nursing homes that if I had had the state inspectors in my building and they observed even one person going from room to room with the same personal protective equipment on, we would have had a citation. If they had seen the whole facility reusing personal protective equipment, which was intended to be discarded, I think I probably would have been put into receivership, but that was then. And receivership means that they come in and take over your facility. But in this day and age, we were in an emergency situation. So actions had to be enacted that were not in the way that we would normally do something. I was a former infection control nurse. My hair stood on end when I saw some of the things. And like now we tell people, well, we're not going to monitor for 10 days. We're going to monitor for 5 days. When what we had looked at in putting plans together was what is the incubation period? And that's how you determined what you were going to do in terms of how long you had to follow things. So everything is different because the numbers are different. We didn't have the political actions that we have going on now. In prior eras, people were told you stayed inside or you wore a mask or you got vaccinated. It was mandatory. We're in a different world. These things are not happening today, and we see the repercussions of it.
Yes, we don't have the full cooperation.
Yeah. And you see such a difference in it. In a lot of the talks and presentations that I do when I'm using like a PowerPoint, I pull up the big map that's all red now for Connecticut. There's only one little white spot on the map, and it happens to be Canaan, Connecticut. Canaan has virtually no COVID.
Wow.
They're virtually 100% vaccinated. Almost 100% of their people have had at least one shot, and a very high percentage have had 2 or more shots. And they're still using masks and enacting other things. So you look at how they are. And in public health, you monitor everything in the equation of what we call how many people of 100,000, so that you can take a big city or a little city and make it equal. So if we look at that, they are doing phenomenally. There's not another community in Connecticut that is succeeding the way Canaan is succeeding.
So, Dr. Stephanie, they have the same they're supposed to be going by the same government standards, right? Yeah. Why is that town different? And I know it's a small town, but why is that town?
Yeah, and the small shouldn't matter again because it's measured against 100,000 people. They have less than one. I think it's less than 5 people per 100,000 people, where in say, my community, Greenwich, we have 111.1 per 100,000 people. But they're insisting still on mask use there. What I tell people when I do programs is use your common sense, because somebody says you can do something doesn't mean you have to do it. I don't care who tells me I don't need a mask. My common sense as an infection control nurse tells me I need a mask.
Sure. But are you saying that in that town, the stores and the restaurants have a different protocol than the rest of the state?
Well, each government in a town has been able to enact what they want to do, their own guidance. And from what I've read, I've never been to Canaan. I don't even actually know where it is other than on the map. From what I've read is they're still using masks and putting a lot of safety protocols in place.
Mhm.
And if I were running something, I would be doing that too, because I know the infection control component.
Sure. Now you're also doing contact tracing. Tell
Yes.
us a little bit about that and how is that going?
Well, I got involved in the contact tracing. In fact, I came back to Greenwich initially. I retired from Greenwich back in 2009 when I started my own company. And I came back because the contact tracing is very labor intensive. Most health departments are small. They don't have large numbers of people. So what contact tracing aims to do is to find the people who have COVID and identify where they might have picked it up, where have they been that they could have spread it. One of the things that's so dangerous about COVID or so upsetting about COVID is that you can have it and not even know it. So many people have COVID without a single symptom. We check temperatures. Well, many people have no temperature. We never in America did what public health would say you should do. Everybody should have been tested and repeatedly tested. We only tested people who had symptoms. Well, if you're testing people who have symptoms, you're testing people who you're pretty sure already have it. We needed to be testing all those people we didn't know had it so that we could put measures in place like the contact tracing. So what we do is we call the people when we first get their test result. We find out, of course, how they're doing. How are they managing? Do they have questions? We send out packets of information to them, packets of masks. And then we talk to them about where in the 2 weeks before they became sick, where had they been? Had they traveled out of the state or out of the country? Where did they go? I mean, if you look at our map here in just in our country, we have really big hotspots of places that won't get vaccinated, won't wear masks, and the numbers are spiraling. And we're seeing that again now with the Omicron, and now the Omicron subvariant too. So we can't seem to get a handle on this because we don't have the infection control measures in place. So with the contact tracing, we call them back several times and we check on how they're doing. Do they have questions? Some of the people in the community are very sick and others of them are not. But it's largely the people who have not been vaccinated who are the very sick people. I just had my first person who died, and I had called, and the husband answered the phone, and he was obviously an older man, and she was an older woman. And he says, "Oh, you just missed her." And I thought he meant she'd gone out, and I'm thinking, what? She's gone out with COVID? And he says, "No, she died in the ambulance on the way to the hospital."
Oh,
And it broke my heart. So I
yeah.
chatted with him because I could hear his need to talk, and he was kind of a little tearful and talked about how in all the years they'd been married, he was in his 90s, she was in her late 80s.
Oh,
He had never been alone. His bed had never been without her, and how lonely it was for him the night before.
oh, that's heartbreaking.
Yeah, it is.
This is a very heartbreaking disease. So,
Indeed.
is there something new that we should know now that it's gone on for 2 years almost?
Yeah. Well, the thing about viruses is that they change. And because they change routinely, things are always going to be new. A virus is not a live entity, so it invades a host cell. And that's how it does its damage. So you can't kill a virus. So the things that we've been working on, or not me, the scientists have been working on, are the vaccines which came out, which are remarkable pieces of technology. Now we have antivirals that have come out. There's a vaccine about to come out for children as young as 6 months. So
Yeah, I read that this morning. I saw that on the news. Yeah.
Yep. We have Pfizer putting their vaccine out to have it approved for, I think it's 16 to 18-year-olds, the younger group than they've been doing. Moderna is coming out with their vaccine for younger people. So we're moving forward in all kinds of ways. But there have been other things that really impact our senior folks, like many people may not be aware that the hospital, that the governor or the health department put out a request to nursing homes to take COVID positive patients when they're out of the acute stage in the nursing homes. And that's in place right now. And I'm presuming they'd be putting them on special units. And
I mean, to take them back. Like if they are in the hospital, they have to go back to the nursing home. They don't stay in the hospital till they're done with COVID.
well, no, if you look at the figures, the governor puts, everybody should know this, by the way, the governor puts out figures, and it's very helpful to see them every day on what our COVID numbers are, the numbers of cases, how many have increased in the course of the one day before. And it's in the thousands here in Connecticut every day. How many died, what an increase that is, how many people are hospitalized. Well, what we see is that the cases keep growing. They're growing more slowly, but they're growing. The deaths keep increasing, but the hospitalization rates are going down. And we saw this at the beginning. And I remember thinking at the time, why are all these people dying and the hospital rates going down? Where are they going to be if they're not in the hospital? And of course, we saw on the news that people were dying in their homes, and the ambulances would be coming and taking all the people out in the early phases from their homes. Well, it's something to look at. The other thing is that's new for us is that many of us have probably ordered our home test kits. And here in my town, and I presume many towns, the selectmen made home test kits available to the seniors, to the people at risk, and then to people in general. Well, when we look at our positivity rates, those are based on the number of positive cases against the number of people who are tested. Well, if you have tests that are being done at home, they never get to the state laboratory, so they're not counted in our figures. So in the course of doing my work, I plot and I chart and I monitor these every day, all the figures, and I'm seeing all the positivity rates dropping down. And then I put on the side, when did the home testing kits get put out? And you see, as soon as the home testing kits were put out, you begin to see the positivity rate. And the question or the comment would be, if they're testing at home, those figures aren't getting into the state database. So are we really dropping or not? I have a report to the Board of Health, and it's one of the questions I'm going to be asking one of our epidemiologists there.
So talk to us a little bit about this home testing kits. When should somebody take a home test? How effective are they? Should you keep repeating it every few days? What's the protocol for a home test? I have a few dozen of them at my house, by the way.
I've got several too, and everybody should have them.
You can buy them at CVS. You can buy them at all the stores. Yeah.
The home test kits at this point in time are not PCR tests. PCR is the gold standard. Mm-hmm. The polymerase chase. It's like they use in forensic files where they duplicate the DNA. Yeah. Those tests are the most high standard. The ones that we use at home are antigen tests. And if you get a positive on the antigen test, you can be pretty sure you're positive, but you can get false negatives. So you can actually be positive and not have it show up. And the tests cannot show up positive even if you have COVID, if you test too early, if the technique is done improperly. So if you have the symptoms, test yourself. If it comes in negative, test again.
What's too early? So let's say you came in contact with somebody.
Uh-huh.
You were with somebody on a Friday night, and on Monday you found out they were sick. Now, what do you do?
Well, they generally say to test 3 to 5 days after you've been exposed. But if you get that negative test, test again, because somewhere around that 5 days is where you're more likely to end up with a positive result. But a lot of people don't know that the most contagious period for COVID are the 2 days before you show any symptoms and the 2 to 3 days after you show symptoms. So a lot of us are walking around unaware, again, that we have COVID and spreading it to people, which for many people is not going to be a problem. But if one of the people you're spreading it to is someone who's elderly or with a compromised immune system or on some sort of medication for like a cancer treatment or something, they can not only get very sick, they can die. So when people people are always thinking, many people think, well, I feel fine. I don't want to do this. It's not about us. It's
It
about
isn't.
protecting. We are our brother's keepers.
Yes.
And sometimes that's the reason for what we're asking people to do.
And I too love when you talk to people and they'll be like, well, I didn't go anywhere. You went to the grocery store. You went, like, what do you mean you didn't go anywhere? This isn't the first 3 weeks where everybody just didn't leave their house. You've been going places. I've been careful. You've still been going places.
Yeah.
Like, don't tell me you haven't gone anywhere. And also, even if you are like, I have friends that are like, well, I don't see elderly people. Well, but the people you hang around with might have elderly people in their lives. Like, it's a multiplier, right?
That's right. Absolutely.
It's not just you and the 3 people you spoke to today. It's then now the 30 people they know, the 30 people. Like, it's a crazy multiplier. That's why it just spread so quickly.
And another thing that's a multiplier is that you don't have to be in contact with one person. The guidance used to be that you had a high risk exposure if you spent 15 minutes with a person who had COVID, masked or unmasked. Now it's in the course of 24 hours. If you hit 10 people who have COVID and the total amounts to 15 minutes, that's considered a high exposure.
Okay. Now, what about being outside? How much does that help?
It helps a lot. You have considerably better chance of not getting COVID if your area is ventilated, if you're outdoors. I don't wear a mask when I walk around outside, but I do wear a mask if I go inside.
So if you're outside at a outdoor restaurant, because I hear restaurants are like the hotbeds.
Because even in a restaurant, most of us walk in with a mask on and then we take it off. Well, most of us are sitting and eating for more than 15 minutes.
Right.
So if you have a vent above you that's blowing the air in a particular direction and you happen to have COVID, it could be going down the line and infecting someone else. It's a little cold right now for outdoor eating, but a lot of people relied on that. But then again, I saw a lot of restaurants that had outdoor eating, but it was in a tent where all the sides were closed. Well, that's not outdoor eating anymore.
We just made an outdoor space indoor.
Exactly.
It's outdoor, but it's indoor because it's all enclosed.
Yes.
Yeah, so it's indoor. And so if you're outside, what about cold air? Cold, not just being outside, but the cold. Like, if you keep your house colder, does that help?
I'm not aware of anything that says that. I can't answer that yes or no because I've not heard one way or the other that the cold would do it. In the warmer weather, we tend to open our windows, which is good. And ventilation. If you're driving in a car with other people, if you can crack the window, that would be helpful. If you have people in your home, socially separate as much as you can and ventilate if you can. If you have an air conditioner that can blow, like ventilate out, or like even in your car, bringing in fresh air and blowing out the other air, everything you can do is a plus. But the biggest things we can do for ourselves is to get vaccinated, wear a mask, wash our hands, and stay socially separated. It doesn't seem to me that that's asking so much, but yet it is to many people.
Yeah, I know. I understand. What about children that are under 5? Now, I know they're coming out with a vaccine, but the children that are not vaccinated, my grandchild, for instance, I didn't see my grandkids for a month. They live across the street, I was telling you. Did not see them until a week ago for Christmas because my 1.5-year-old at daycare was in contact with somebody with COVID, and then he tested positive. So we took a month because then my 5-year-old got it even though she was vaccinated. She only had 1 vaccine. But the adults did not get it. They're all vaccinated. But we had to wait it out. We had to wait out like 2 weeks. And neither of them had symptoms. What happens? Tell us, like, if you've had COVID, what actually is your safeguard? Because so many people have said to me, I had COVID last year. I'm good. I don't need a vaccine. I'm like, not so last that long?
No. Even the protection we're getting from the vaccine, which is a stronger protection than getting it from getting COVID, we're finding that it's only lasting about 6 months. And that was not something we knew. You all have to remember that we only have a 2-year history on understanding this at all.
Mm-hmm.
So a lot of people say, well, the guidance keeps changing and then therefore it can't be right. Well, the guidance is changing as we learn more and more about what's happening.
Yeah, it's brand new.
Yeah. So we're having to learn this. But I keep coming back to using the common sense with the children. Every child under 5 right now is at risk.
Mm-hmm.
Now, the important thing, and what I tell the parents when I have contact monitoring, because a lot of them are children, I say, I've been doing this since the pandemic started here in our country, in our state, but I've yet to have an extremely ill child. And I think that's important to remember. The children do tend to bounce back. But with this new Omicron variant, we've all heard on the news just in the last couple of weeks that there have been a lot more children hospitalized and a lot more children dying from it.
Well, this variant seems to be affecting kids more than I didn't hear a COVID affecting kids. I didn't hear it. It probably was, but I didn't hear of it. But now I hear like so many kids have gotten Omicron.
Yeah.
But so tell me, how long were people that think they're protected? How long are we protected if we do contract Omicron or COVID from getting it again?
Again, we're still learning, but it's looking like it may be 6 months.
Oh, 6 months.
Maybe.
I thought that was for the vaccine protection.
That's for the vaccine too.
Oh,
but
for both.
That's what I'm hearing. But I don't know that any studies have been done because we don't have the element of time here behind us to say that this is actually the way it is. What we are finding is that even people who have been asymptomatic are ending up with long haul COVID symptoms. And that's including some of our young people. And they're seeing this in, like, if they're runners, that they're short of breath and things that are unfortunate.
You mean after 6 months? After, yeah.
After getting COVID, or even not knowing they had COVID when they test positive for COVID. But in terms of the safety that we get, it appears that the protection we get from getting the vaccine is a stronger protection than you get from getting the disease.
So is it more, are there some people that are more susceptible to it? Because I have a CNA who she's triply vaccinated that works with me. She's had COVID about 6 times, and she even just got it. She had it for like 2 weeks pretty badly, and she was vaccinated. And I'm just like a COVID magnet. I'm like, how does she keep getting COVID? I don't understand.
Well, she may have underlying health conditions. And that's one of the things we ask, because we check all the cases we do with the contact tracing. We ask, do you have any underlying health conditions? And initially, before maybe 2 months ago, a lot of the people seemed to show up that they did have some underlying condition. But now I'm seeing less people saying that, yes, I have underlying conditions. And they were all, almost everybody is vaccinated. The ones who aren't, as I said, are very ill or get a tendency to get very ill. But some people get it again and again. What the vaccine does is it's not going to prevent you from getting COVID. What it's going to do is prevent you from ending up in the morgue or the ICU. That's what it's intended to do.
But is it easier to get COVID if you're certain, I don't know,
yeah,
blood type, or is there a reason that some people have gotten it repeatedly?
The people who have all from the very beginning, when we were putting out people who is at risk, and like when I've talked to people or written articles, I'd say, let's look at it in terms of your risk. Are you a high-risk person? Is your child a high-risk person? Who is a high-risk person? Well, if you're Black, Hispanic, or one of the indigenous people, you're automatically at a higher risk.
Really?
Yeah, for many illnesses, not just COVID, but that seems to be the case. If you are elderly, your immune system may be declining. That puts you at higher risk. If you have heart disease, kidney disease, lung disease, you're at a higher risk because you're more vulnerable. If you're on chemotherapy or any immunosuppressant drugs, we have so many people in this country who have what they call orphan diseases that are not as big or in numbers as some of the other diseases, but those are still huge numbers of people. If you have health debilities, you're at higher risk. And that goes for children as well as adults.
Why are Black and Hispanic people at a higher risk?
I don't know the answer to that, but they're at a higher risk for almost every illness. They're higher risk for diabetes, higher risk for,
Really?
yeah, for blood pressure problems, for kidney problems. And when you read my credentials there, you talked about being on the Connecticut Commission on Health Equity, where we looked at all kinds of things. And we know that people of color and people who don't speak English do not get the same level of health care as people who are white. It's been documented and studied all over the place. We know that the infant mortality rates and the maternal child health rates are lower. They're for people of color and people who are non-English speaking in this system. So we need so many more studies on that, but our system does not provide the kind of care that other industrial countries provide. We have a lot of people who go untreated, a lot of people who are undocumented, a lot of people who are uninsured or underinsured who can't get the help they need. And in terms of COVID, I think we've certainly seen that it has hit the Black, the Hispanic, and the indigenous populations to a much higher degree than other people.
Give me your opinion of shutdown, lockdown situations in assisted livings and nursing homes, safety from COVID versus isolation, loneliness, not seeing your relatives.
Yeah, it was a terrible situation that we had because loneliness and isolation in seniors has been a problem long before COVID, and COVID certainly exacerbated that. People who were very ill and fearful and maybe worried that they were dying, who couldn't see their loved ones, the loved ones on the outside who couldn't get in to see their people, their loved ones, the elderly folks. It was terrible. I think that there were certain measures that had to be done, and we have done this historically in healthcare facilities. Like every year when the flu situation comes up, there are protocols in every facility, and you're required to have them. How many people on a unit can get sick before you have to take measures to isolate that unit? How many people in the facility have to be sick before you have to close a facility? So COVID was not the only time that we did that. And it just that it happened so quickly and the numbers were so staggering that I think it terrified people. No matter which angle you looked at it, it was terrifying.
And it was for such a long time.
For such a long time.
It wasn't a week or 2 weeks. It was months and months and months on end.
Yeah. And for anybody in your audience who is interested in it, the governor puts out figures every Thursday. He puts out every day for everything about COVID.
I get the email. I read it every day.
Every Thursday, he puts out the numbers of deaths for the week. And he also puts out the COVID report for nursing homes and assisted living facilities. So you can go into that, and it's depicted by town. And then when you look at the town, all of the different facilities in the nursing home list and in the assisted living facility come up. And you can tell who in a facility, how many patients have been infected and how many staff have been infected and how many have died. So you get a very good picture. It's a tough time right now for people to be looking at facilities for care because people are scared, and our numbers rise up and down. With that positivity rate that I've mentioned before, according to public health guidance, the positivity rate should be 5% or below for at least 2 weeks continuous before you lower your protocols. And we haven't been below 5, but twice since December. We had a 2% and a 4% somewhere in mid-December. but our COVID numbers have been very high. We never hit a level that would have said if I were going by public health standards to drop masks, drop social isolation, drop this. But there's more than just the public health perspective to take. And it's a really tough decision for somebody like the governor or a selectman or whatnot to weigh the business interests, the human interests, the economic interests, and there's so many different components. And someone has to make those hard decisions.
It is affecting every part of our lives. Not, elderly, social, business, financial. It's affecting every decision.
Yep.
It's affecting everything. I have friends that did not put their parents that needed to be into a facility because they wanted to see them for Christmas, or they didn't want them to be alone.
Yeah.
And they kept shutting down. So it's a big one.
It's tough. It's tough.
So if we're vaccinated and we wash our hands, I'm like washing my hands incessantly now, which I didn't do as much before. I have to be honest. Like now, coming from the store, coming from outside, I'm always like washing my hands. But if we wash our hands all the time and wear the mask, and is only the N95, is that the only good mask now? Or are we supposed to throw out all the other masks?
Well, no. The N95 is the top of the line. And what that 95 stands for is that it filters out 95% of the things that could be coming into you. The KN95 is the Chinese version of that. And now there is a Korean version of that, which I think is like 96 or 9. It's somewhere in the 95, but not. All three of those are decent, but there's medical grade and there's not medical grade. Like if you were working in a healthcare facility, you would want to be looking for what they call the NIOSH certification and the FDA approval and all these different things. For most people walking around, like to wear their mask to go to the store, to visit with people, we don't need that highest level. Great if you can get it, but they're in short supply for healthcare providers.
Should we be throwing out our cloth masks and just wearing these N95? They're pretty cheap. I just ordered a bunch from Amazon.
Yeah, I have a whole bunch.
I thought they'd be more expensive. They weren't.
No, that they're not. Mm-hmm. And I would wear the cloth mask in certain areas. Not the cloth. I've never thought the cloth mask did anything. Personally, it's my own personal opinion. But this kind of a mask I'd wear if I'm perhaps going to a supermarket or going somewhere. But in an era where we're having high numbers again, I switch immediately to my KN95 and put that on. The problem with this type of a mask is that for most people, they're gaping around your face. Mm-hmm. When it's gaping around your face, the air is going out and it's also coming in. When you have a K95 mask, or rather an N95 mask, in healthcare facilities, you actually have to be fitted for that by a person who is trained to do a proper fitting. Mm. And, people are picking up K95 masks or N95 masks, and I don't even know if they know how to do the test. Like if you had I don't have one sitting here with me, but if you had on a KN95 or an N95 and you put your hands around the mask and you breathed in and breathed out, you should feel that mask going in and out. If you don't feel that, you don't have a seal.
So you have to have it nice and tight so air's not coming in and out.
If you don't have a seal, you lose your protection. But, when COVID first happened, I spent 55 weeks with, I don't know if you're familiar with that home in Greenwich. I was one of their early members and on their board. Now I'm on their advisory board. I did weekly telephone shows or conversations with the seniors. So in 55 weeks, we covered every conceivable aspect of COVID, keeping yourself safe, common sense, how to sanitize, the myths versus the facts. I think if there's one message I would want to get out to your audience today, is that we have so much misinformation, intentional and unintentional, that it's so important for people to stick to the bona fide science. Some of the things you read out there, you wonder how people believe it, but people do. I remember when the issue of injecting bleach or breathing bleach, and everything came up. And I thought, oh, that nobody's going to. I had phone calls from people asking if they should be doing that. I wrote an
What?
article immediately and said, I can't believe I'm having to say this, but no, do not breathe, do not inject,
Oh my
inhale
gosh.
bleach, Lysol.
Again, common sense.
Where's the common sense?
Listen, even if that was a thing, why would you do it?
Exactly.
Like,
Yeah.
that
A
makes
virus
zero
is
sense.
not a parasite of the sort that's a worm or something that animals get. Ivermectin will do nothing
We're
for
not clothing.
COVID. A virus is, as I said, it's not alive. You have to deactivate it. It's not a worm. It's not a bug. It's not a bacteria. It's
Crazy.
not a fungus.
What about the plastic gloves that we all wore for the first few months and cleaned all our groceries? And is that a thing we should still be doing?
Well, I think maybe we all went a little bit overboard at the very beginning because we were trying to keep very safe. I don't wear my gloves. I prefer to clean my hands. So if I'm touching something, a lot of people touch their face and touch the outside of their mask. You shouldn't be doing that, because think of it like a vacuum cleaner, or an air filter. Anything coming through the mask is sitting on the surface of it.
Yeah.
So if you're touching the mask and you've been around someone with COVID and then you touch your eyes or your face or your nose, you're putting those viral particles into your eye, your nose, your mouth, etc. So wash your hands, keep your hands off your face. Most of us don't even realize how many times a day we touch our face. It's so automatic.
I realized that when I was always adjusting those masks. I wear glasses.
Yep, I do the same thing. And
my
you almost
glasses are fogging, and I'm like, oh my gosh, I touched my mask again.
Yeah.
Oh my god, because my glasses are fogging up, and it's a little bit of a pain in the neck.
Yeah.
So if you get COVID, what should you be doing?
Well, if you get COVID, you should rest assured that your contact tracer is going to be calling you and going over all the instructions with you. You should be checking your temperature a couple of times a day. You should be monitoring for symptoms. If you have significant symptoms, it's important to contact your doctor or your healthcare provider, because if you're going to get something like the monoclonal antibody treatments or the antivirals, you need to do those in the first early days. So
why should you be checking your temperature?
Well, you should be checking because a lot of people will get a temperature elevation. A lot of people won't. But if you have one, it's one more symptom. And some people's temperatures go very high, particularly with children.
So you're saying you should check your temperature to make sure it doesn't go dangerously high. And if you check your temperature and you have a fever, can you take Advil, aspirin?
Advil, Tylenol, and anything like that to lower the temperature. But before we can clear someone from being monitored and say you're ready to go back to work, we look to see, have they been off a fever-reducing medication for 24 hours so that we can know that they actually don't have a temperature. If they're coughing, we don't want somebody going back to work at 5 days. It used to be a 10-day monitoring. Now it's a 5-day monitoring and you go back to work. It used to be if you were sick in school, you stayed out of school, but now it's mask and go back and things like that. So we need to really have people focus on the proper wearing of the mask, the proper hand washing, maintaining social distancing, and things of this sort. But going back to your question, you want to watch for the danger signs of COVID because it can go downhill very quickly. And some of those danger signs are severe trouble breathing, pain in the chest that some people describe like a heart attack. If you see your coloring, particularly around your mouth or your nail beds, getting kind of purplish, it could be an indication that you're not having sufficient oxygen.
Oh.
Yeah, we suggest to people that they get the pulse oximeter, the little thing that goes on your finger at the hospital. Yep. And it should be in the 98-ish range. If yours is dropping way lower, you need to get checked. COVID pneumonia has a very distinct look on an x-ray. It looks like your lungs are filled with fiberglass or cotton candy, totally different from what other things look like. But you're not going to know that at home. There are things that should tell you, get checked. You need to be physically checked. So
I want to say those little finger pulse things. Mm-hmm. They're like $5, $10. I bought those as well on Amazon. You can get those.
They're very cheap. Okay.
Very cheap. You can get them.
And it's a good thing to have.
But if your symptoms aren't that bad, I've heard doctors tell you to stay home.
Hmm.
I use like a cough expectorant
Yeah.
to keep down, and they say don't sleep on your back. Sleep with your pillows propped up, so the fluids are not, I guess, staying in your chest. Like sleep on your side with pillows propped up. And are there just
Yeah.
things like we should be doing if we have milder symptoms to get rid of it and be comfortable?
Yeah, I think that the key is to be comfortable. I mean, if you think of how we treated the COVID patients in the ICU at the beginning, we had them on their backs and we had them in certain positions. Then they learned if you're sleeping on your stomach, what they call the prone position, that they breathed better.
Mm-hmm.
So it's different. But you really need to monitor the symptoms. You want to see that your symptoms are improving, that they're not going in the wrong direction. And if you do need to go and be checked at your doctor's office or an emergency room, you want to let them and the ambulance know before they get there that you have COVID so that they can take the extra precautions and get you right into a room. They may tell you to wait in the car until um, until your time comes to get into a room. And when you go into the emergency room, they generally will close the door now to keep you
Mm.
isolated and
Wow,
keep you isolated. So,
that's great.
yeah, it's
So,
different.
so Dr. Stephanie, do you see an end to this in any of the near future at all? What are we looking towards?
I think if more of our people got vaccinated, there'd be a better chance that we'd see an end to it. But my own feeling is that we're very likely to be having annual vaccines the way we do with the flu. I can't say that for certainty, but that's kind of where I think I see things heading. Um, Viruses change continuously. And if you have these little tiny drifts, they change a little bit. But if we have a shift, like appears might have happened with the Omicron going from Omicron 1 to Omicron 2, it was a much bigger change and there was a lot more concern. We saw this in the Spanish flu and the avian flu when a virus jumps from an animal from being able to infect animals to also being able to infect people, that's a big change.
And can this virus
That's
affect
a big
animals?
virus makes.
Can this virus affect animals?
I've heard one or two things that it might have, but I don't think this has made the animal shift the way that I have heard that dogs have gotten it and that some tigers in a zoo had gotten it. So I don't really know the answer to that, but I've only heard of isolated cases and I don't know what kind of studies were done to see how valid the report was.
And now you might not know this because I know you are studying 24 hours a day, everything about Connecticut, but are there any countries that have almost eradicated it because they're fully vaccinated or have kept? I know countries like New Zealand have been very good about not letting people in and out. Are there any countries that are doing so much better than others?
There are, and I can't remember one. New Zealand, I think I just heard this morning, was getting ready to reduce some of their restrictions. It might have been New Zealand, but there are some that do better. But we've had ones that did better, and then there were switches in the virus or a new surge. We may yet surge again. We don't know that yet, but America has been at the bottom of the heap in terms of how we've done as a country for the longest while, because our healthcare system is not what some other countries have. There are pros and cons to all the different systems, but we have some unique frailties in our system, as do other countries. But I'm not aware. I couldn't answer that question as to whether anybody has done exceedingly well, but I did hear, and I think it was New Zealand, may be opening up a little more.
Yeah, I hear they're one of the countries because they're an island, so they've been able to not let people in and out, which was helpful.
And look how strong they acted when they had the person with the unvaccinated tennis player. Wasn't that New Zealand too?
Yeah, I thought that was amazing because you have to keep the line, right? You have to make sure.
Absolutely.
Yeah, so I appreciate that. Interestingly enough, I was telling you I was recently on vacation. I was in Mexico on a beach thinking, we're all good. And we were. But everybody everybody on that little island of Cozumel was vaccinated that worked there, and Cozumel had a very high vaccination rate, and they were all masked no matter what they were doing, and hand washing everywhere you went, and they had police going around like making sure all the workers were masked and doing what they were supposed to do. Yet they let anybody and everybody in unvaccinated and no test.
I know.
And I was like in shock when I found out, that you didn't need this. And I am 100% sure it had to do with tourism and economics, because the island almost collapsed in the beginning of COVID. They really had no money, and they don't have a support system. So I'm sure, and I was like so appalled, how are they letting their people be so unsafe? It's a tiny island. It's economics. They need to let the tourists back in.
Yeah, as I said, there are so many different factors to weigh. It's a tough decision for anyone in a decision-making capacity to look at. I mean, which takes a higher precedence? The economics, the isolation, the public health. And it's a difficult choice.
So much. Well, Dr. Stephanie Paulmeno, you have been amazing. You are a wealth of information. I learned so much from you already. So we just need to stay the course. And as you say, keep just thinking rationally, wear the mask in public, stay outside as much as you can if you're going to be with other people, wash, and be vaccinated.
Yes.
Get those boosters, get whatever it takes. What's the big deal?
Absolutely.
What is the big deal?
We get vaccinated for so many other things. Why is it different here?
I don't understand. And I love that people will get a flu shot and they don't want to take this shot. I'm like, not sure, it's very different. But anyway, to me, it's the same. So it's just, more helpful. Because anyway, thank you so much for coming on.
Oh, it was my pleasure.
You're a wealth of information. You're a beautiful person inside and out, and you do amazing things. And I love that you are just so community minded. And thank you so much for helping the community during this pandemic. It's been crazy. So thanks so much.
Thank you.
I hope to see you again.
You take care.
Bye-bye.
Bye-bye.
That is Dr. Stephanie Paulmeno. Wow. This lady is a wealth of information. She has so many credentials to her name, and she has just devoted her entire life to nursing, science, and helping people stay safe and alive. So I hope that you appreciated her information, because she really knows what she was talking about. Well, thank you so much. And please get vaccinated, stay vaccinated, keep doing whatever is required so we can end this and we can all be free and happy and living in peace and harmony, and everybody is safe. Till next time.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who feels not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home, as it will be only number 6 for Connecticut. Brand new, sparkling clean, and safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson issues. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.